Good evening and a warm welcome to all of you to our special web series on cancer care, New Normal, Same Cancer. This special web series of web shows is brought to you by IHW Council and AstraZeneca. I'm Manisha Nair Dhawan, your host for the show. Now, we've started a new year and a new decade, yet we are still perhaps unable to shake off the blur that 2020 was, with our lives still reeling under the effect of the COVID 19 pandemic. Now, many of us make New Year resolutions at the start of a year, and hopefully, after the coronavirus scare, many of us have thought about taking care of our own health and well being and resolving to make this our top priority this year. Now, the fear and anxiety of keeping oneself safe during the pandemic has taken a toll on many of us. But now we have to rise above this fear and reconnect with our own bodies because cancer does not wait. Cancer hasn't taken a vacation because there's a pandemic going on. So, in this new normal, many cancer patients have fallen back on their treatment, and new patients are being diagnosed in advanced stages because of their reluctance to visit a hospital. Now, with the series of web shows, we want to say don't wait, contact your doctor, get checked, avoid contact but not treatment. Yes, this is possible and imperative. On our show today, we will discuss ovarian cancer, which is the seventh cause of death and morbidity in women worldwide. The overall 5 year survival in ovarian cancer is only about 45% in our country, primarily due to the late stage of diagnosis of this disease. So, what are the symptoms of ovarian cancer? Who is at risk? How is it diagnosed and treated? These are some of the questions that we will be taking up during the show. The show is, of course, supported by AstraZeneca. So please join me in welcoming our esteemed panelists who are joining us on the show and discuss all these issues. Please welcome Dr. S.H. Advani, Director, Department of Medical Oncology, Jaslok Hospital and Research Center, Mumbai. We also have with us Dr. Shona Nag, Senior Medical Oncologist and Director, Oncology Department, Sayadri Group of Hospitals, Pune. We have Ms. Urvashi Prasad, Senior Public Policy Specialist in the Office of the Vice Chairman, Niti Aayog. We also have with us Ms. Shilpa Raka, Director, Raka Infotech and ovarian cancer survivor. And we have another ovarian cancer survivor with us, Shivani Charak. She's sports climber and Indian team player, and of course, a survivor of ovarian cancer. A warm welcome to all of you for coming onto the show to raise awareness about the critical cause of cancer and the timely treatment that is required to beat this disease. Dr. Advani, let me start with you. Now, ovarian cancer is seen as a gynecological cancer that affects only women. Now, women's health is not priority for most people. So, to your mind, what is the level of awareness about ovarian cancer in our society today?
Yeah, I think unfortunately the awareness about particularly ovarian is extremely low, particularly in the uneducated people. Sometimes they don't know even what is ovary. So the only thing which they know is the cervix cancer. That is known to everybody. But ovarian, there's hardly people are aware. The important thing is not just awareness, but important thing is its location. Its location is such that in the early stage, it does not give any symptoms at all. And therefore, the early stage disease is diagnosed only by chance. Somebody goes for the regular sonography, you diagnose. Otherwise, early stage ovarian cancer diagnosis is extremely rare because of its location. However, I must say that over a period of time, now the awareness is increasing, particularly people, those who are going for the regular yearly checkup, executive checkup, which is done now in all the hospitals. They are able to pick up on ultrasound, the yearly checkup, the mass in the pelvis. So therefore, I think public awareness is low, but public interest in the regular yearly checkup, which includes the ultrasound of abdomen and pelvis, is really helping to diagnose this disease early.
Right. Dr. Nag, I want to ask you, Dr. Advani said that, now people are going for annual ultrasounds as part of the executive checkup, so they are able to find out. For, cervix, we know that doing regular cervix pap smears, helps you catch cervix cancer early. Mammograms are also screening methods for screening of breast cancer. How effective is an abdominal ultrasound? Because as part of an executive checkup, or it's fine, you get it done. There's a probe on your abdomen, it's fine. You know, it's no problem. But not many people get executive checkups done. These are, a very small part of the organized workforce. Secondly, it's also believed that this is generally picked up in a transvaginal ultrasound, which is more costly and somewhat more invasive as well. So, how effective are these abdominal ultrasounds, and are there easier ways to pick it up early?
So unfortunately, as Dr. Advani rightly said, that ovarian cancer does not lend itself to screening. Screening is where you detect an asymptomatic normal individual to have a tumor or a cancer like breast and cervix, as you rightly pointed out, and then you're able to treat it. So transvaginal ultrasound, then they used Doppler methods, they used all kinds of variations of ultrasounds, but picking it up really early is difficult. It can be an incidental cyst that you pick up, and then you have to figure out whether it's a complex cyst or simple cyst, and that lends itself to further investigation. We have a tumor marker for ovarian cancer called CA125, but that is not good for screening. It's only good for following up a patient and for detecting recurrence. So really, we have failed world over to diagnose ovarian cancer really early. But if women can watch out for symptoms like, and they're non-specific symptoms. So the problem is that if you educate women, a lot of these women will have these symptoms and then go into a panic mode. But a trio of abdominal pain, indigestion, frequency of urine like you do when you're pregnant, and constipation. I mean, these are things when they keep happening. Don't ignore it. It happens once you think it's acidity, but it keeps happening repeatedly. Go and get an ultrasound done. Go and seek an expert's opinion. Also, if you come from a family of breast and ovarian cancer, if somebody in the family or one or two members have been diagnosed, your threshold for these complaints or your threshold for doing ultrasounds should definitely be lower. And then you can be more vigilant about yourself. And 15 to 20% of ovarian cancers have a genetic origin. I mean, they have a hereditary component. So I think that's important to keep in mind.
Right. So we have a few survivors of ovarian cancer who are joining us, and actually, to some extent, there are influencers and celebrities now opening up and talking about cancer, and that really helps also create awareness and a resonance, because influencers are tracked closely, and when you hear that so and so had cancer and has beat cancer, then the entire fear about cancer comes down. So I want to ask Shilpa, who's joining us. Shilpa, how did you figure out that something was amiss, and you figured that you were told that you had ovarian cancer? Dr. Nag said, indigestion or heaviness in your abdomen. Me and my friends keep chatting कि पता नहीं आज क्या खाया, शायद बहुत ज्यादा दूध पी लिया, बहुत bloating होती है, और शाम को तो हमेशा ही bloating होती है, सुबह अपने तो ठीक होते हैं. So these are so non-specific, and you were like,
yes.
Oh, now of age, now I guess this is because of age. So, and nobody thinks it's cancer. So what struck that bell in your case, Shilpa, that you decided that something was wrong and I must get it investigated?
Yes, it was an unforgettable day when I was unable to drape a sari on that my bloated stomach. It was a evening time again. So even I had also thought that it could be a gases or acidity. But then after a couple of days, I thought that I should go and see a doctor. I went to a doctor. She said that it's something sort of a chikungunya. And I then again went to the another doctor. He said it is food poisoning. I again went to the third doctor. He said it is a start of jaundice. I keep on trying to tell them that please prescribe me a sonographist because there is something uncomfortable in my stomach. But I think they were more confirmed on their own diagnosed. So I went myself to a sonographist, and he actually done my sonography for 40-50 minutes, and I was so irritated after going to those three doctors and then to the sonographist. I said, what is the problem? He said, there is no kidney, there is no ovaries. I said, where I've kept it? I've not kept it at home. They must be there. You please see where it is. So then finally I told him that you please write it down, give me a report, whatever you can see and whatever you are not able to see. He gave me a report in that sort. I clicked that photo, send it to my one of a gynec friend. She only told me one thing, that Shilpa, don't go home, get admitted. So I got admitted, and in very initial sonography, doctor said that we are suspecting cancer. I was literally shocked, very shocked. And that news came to my daughter first, and that was more painful for me. It could have been come to me, I would have handled it more powerfully, but it was a bad thing that my daughter has to listen all the first news of it. So my whole family was in a very collapsed state. I keep on thinking, why I that is a very typical question every cancer patient thinks. But fortunately, after a couple of days, I got a very positive and clear answer to it, that every brands need a brand ambassador. And maybe God has given me this work of a brand ambassador. And how can I uh, make God selections wrong? So I have to be a rightful in that path. So this was my story about knowing my cancer, but I was very adamant to go for a sonography. Otherwise, I would have lost 2-3 months at least in that chikungunya and that jaundice and all those, you know, disease to cure their tablets and all those things. But I was very adamant to go for a sonography at the first place.
Mhm.
Thank you.
Yeah, that was very a well thought of decision, Shifa,
Yes,
and
very timely.
timely for you.
Yes.
Urushi ma'am, I want to understand from you, both doctors have told us that the symptoms are non-specific. They won't tell you, oh, it's ovarian cancer. So, when Shilpa has told us, she went to a couple of doctors and she was given different diagnoses. So now we can't blame doctors that how come you didn't tell her it was ovarian cancer.
Yes.
Everyone is not an oncologist, right? So, do does something need to change so that we can detect it earlier, and the this misdiagnosis, if I say so, or the time that is lost can be saved.
Yes, I think, of course, we know we have a shortage of, specialists, of doctors, and that is, of course, a chronic problem for our health system, which we do need to address. But in the meantime, we can certainly train or better train our workforce. For instance, we have these health and wellness centers coming up across the country. And we can at least train our workforce to alert women to some of these possible non-specific symptoms or risk factors. While ovarian cancer might not be and is not amenable to the kind of large scale screening that you could perhaps do with breast cancer, with cervical cancer, and of course that is very much part of the health and wellness centers. But for ovarian cancer, if we can at least train the teams which are operating these centers, because they are supposed to be dealing at the primary care level with communities. So they are supposed to be that sort of first point of contact, to at least alert women, and to themselves be able to recognize, if a woman is coming to a health and wellness center and she says, look, I'm feeling bloated, or I'm feeling something which is not quite right, then at least be able to refer her, to the next level of care, or at least say that, okay, this needs investigation. So yes, they will obviously not be specialists immediately at all those levels, and we don't even need specialists at all levels. But we at least need a workforce which is, trained and skilled enough to be able to just spot that, something's wrong, and something needs further investigation from a specialist. So yes, I think we, of course, need to increase our numbers, purely of people who are skilled in the workforce and able to do this. But we also need to provide the right kind of training at all levels of care, not just the secondary and tertiary, but also the primary care levels.
All right. Dr. Dwani, I want to ask you, like Shilpa said, the first thing that came to her mind, why me? Why did I get this cancer? So are there any risks for getting ovarian cancer? Are few ladies more prone, like Dr. Nag said, that, if you have a family history of breast cancer, ovarian cancer, does that increase your risk of getting ovarian cancer? Are there lifestyle factors that could impact you and could lead to ovarian cancer? Could you throw a little more light on who's at risk here? Dr. Dwani, I was asking you about.
I heard the question. So I think the important thing is there are some lifestyle reasons which are responsible for the ovarian carcinoma. We know obesity is one of the most important factor for the ovarian cancer, and that's why world over the obesity is increasing, particularly in the Western countries. The incidence of the ovarian cancer is also on the rise. So you see the people who are obese, hypertensive, diabetes, they have a high incidence of ovarian cancer. I think second important thing to realize is the age. If the patient is, ladies are between the age of 40 and 50s, and at that age you get any abdominal discomfort, I think one should rule out the ovarian cancer. That's the most important thing. Because in other age groups, it can occur. Ovarian cancer can occur at any age. But 40s to 50 is the commonest age. And that's the time people have menopause, some changes in the menstrual cycle. So normally people attribute everything that happens to them to that. But it may not be that. It may be the, and therefore a simple, again I say I must stress upon the ultrasound, a good ultrasound. When I say good ultrasound, it's not the machine, it's the operator. A good operator can really do a good justice for detecting early the ovarian cancer. So I think the lifestyle factors, the age really can give you a sense that you should rule out the ovarian malignancy.
Right. So Dr. Advani has said that women in the age group of 40 and 50 need to be more alert of any abdominal discomfort and should get it investigated should it persist for too long. Now we have with us Shivani Charak. She's a survivor, and by quirk of fate or by sheer bad luck perhaps, Shivani was diagnosed with ovarian cancer at a very young age. शिवानी, आप सिर्फ 9 साल की एक बच्ची थी जब आपको बताया गया कि आपको कैंसर है. क्या हुआ था? आप बताएंगे हमें, आप क्या कर रहे थे और कैसे आपको पता लगा कि आपको कैंसर है?
मेरे घर पे एक न्यू ईयर का पार्टी चल रहा था मेरे कजन का, तो मेरे को अचानक से पेट में दर्द होने लगा. तो मुझे हर साल एक ही बार पेट दर्द होता था, वो भी हमेशा न्यू ईयर पे. तो पापा मम्मा सब लोग बोलने लगे कि एक बार चेकअप करवाते हैं. तो हम चेकअप करवाने के लिए गए प्राइवेट क्लिनिक में. तो वहां डॉक्टर ने बोला कि ठीक है, नॉर्मल है. क्योंकि मेरे को एक्चुअली मैं जब मेरे को पेट दर्द होता था और काफी देर के लिए रहता था, 1 घंटे के लिए पेट दर्द इतने जोर से होना कि मेरे से बर्दाश्त भी नहीं होता था. तो उसके बाद मेरे को यानी कि कब्जी हो जाती थी, जिसके कारण मेरे को बहुत ज्यादा दर्द होता था। हम डॉक्टर के पास गए, डॉक्टर ने बोला नॉर्मल है, आप मेडिसिन खाओ पेट दर्द की 1-2 दिन की तो ठीक हो जाएगा। वो तो वैसे भी मुझे 1-2 दिन में ठीक ही हो जाता था पेट दर्द। बट फिर भी पापा मम्मा ने जिद किया कि हमने अल्ट्रासाउंड करवाना है, तो डॉक्टर ने तब भी नहीं लिखा। तो फिर पापा मम्मा ने जिद करवा के अल्ट्रासाउंड डॉक्टर से लिखवाया, और फिर हमने एक प्राइवेट क्लिनिक में जाके अल्ट्रासाउंड करवाया। तो वहां पे डॉक्टर ने मेरे को स्टार्टिंग तो वो यही लोग बोलते थे कि नहीं नॉर्मल है, शायद स्टोन वगैरह पेट में या कुछ ऐसा प्रॉब्लम है। तो बट वहां पे जब उन्होंने फाइनली अल्ट्रासाउंड किया, 1 बार किया, 2 बार किया, उन्होंने मेरा 3-4 बार अल्ट्रासाउंड किया, तो उसके बाद उन्होंने मेरी मम्मा पापा को बताया फाइनली कि इसको ओवरी कैंसर है। फिर मुझे उस तरह पता लगा था।
तो शिवानी, आप आपको जब पता लगा ये, तो मतलब जैसे डॉक्टर बानी बता रहे थे, ज्यादातर ओल्डर लेडीज को होता है, और ये मतलब चाइल्डहुड कैंसर, ओवेरियन कैंसर इतना फ्रीक्वेंट नहीं है। तो फिर आपके मम्मी पापा को कैसा लगा और आपको कैसा लगा? आपने कहाँ ट्रीटमेंट कराया और डॉक्टर साहब को क्या कहते थे कि ये कैसे हो गया आपको?
मेरे को ये तो नहीं पता कि डॉक्टर्स ने क्या कहा कि कैसे हो गया, बट यानी कि जब मेरे को स्टार्टिंग में बताया गया था कि मुझे स्टोन है करके, मुझे ये भी नहीं पता था कि मुझे कैंसर है करके, क्योंकि मैं तब छोटी थी, 8-9 साल की थी, तो मुझे नहीं पता था इतना कि कैंसर क्या होता है। तो जब मेरे को चंडीगढ़ पीआईजी में ट्रीटमेंट करवाने के लिए गए, तो मुझे वहां पे जाके ये चीज पता लगी थी कि मुझे कैंसर का प्रॉब्लम है। तो फिर भी मुझे ये चीज मम्मी पापा बोलते थे कि जल्दी रिकवर हो जाएगा, ये हो जाएगा। तो बट जब डॉक्टर्स ने ये चीज बोली थी कि शायद हमें लेफ्ट ओवरी रिमूव करना पड़ेगा, तो फिर भी घर वालों को ऐसे थोड़ा टेंशन हो गया था कि ओवरी रिमूव करना पड़ेगा, क्योंकि मुझे तो आज तक नहीं पता था ओवरी का मीनिंग। जब मैं 9th-10th में पहुंची तब मुझे पता लगा कि ओवरी एक लड़की के लिए कितनी इंपॉर्टेंट होती है, जो ओवरी का क्या रोल है हमारी बॉडी में। वो चीज मुझे बहुत बाद में पता लगी थी कि उस समय मेरे मम्मी पापा इतनी टेंशन क्यों लेते थे। तो जब फिर मेरा फाइनली चंडीगढ़ पीआईजी में मैंने अपना वहां पे ट्रीटमेंट करवाया, तो उसके बाद जाके मेरा रिकवर हुआ।
ठीक है, तो आपकी ओवरी रिमूव की गई थी कि
हाँ,
दूसरा कुछ ट्रीटमेंट हुआ?
नहीं नहीं, मेरी लेफ्ट ओवरी रिमूव की गई है।
ठीक है। शिवानी, हम आपसे और बात करेंगे, समझेंगे कि आपकी ये जर्नी कैसे रही। पर मैं एक दो सवाल डॉक्टर शोना नाग से भी करना चाहती हूँ। डॉक्टर नाग, childhood cancer is very hard to come to terms with, and very difficult to understand why it happens. And we have a living example of Shivani, who has at a very young age beat this disease and is still with us, and she's doing great guns for our country. She's going to be representing our country most probably
Right,
in the Tokyo Olympics for
right,
climbing. Now, I want to
right,
understand from you
right.
that Dr. Bani is saying between 40 and 50, you should be on the lookout and you should be careful. Now, is there anything else I can do so that I increase my own resilience, or anything that may have a benefit so that I don't get, ovarian cancer? Could it be, early pregnancy and breastfeeding? Could it be oral contraceptives, or some women, if they have a problem or cyst, etc., they say just get
Yeah.
the ovary out, and the whole problem is gone. So
Hmm.
anything that a patient, or not even patient, any woman can do to try and increase her own body's resilience and perhaps keep these risk factors away.
No, I think as Dr. Advani also pointed out, lifestyle always plays a very important role in ovarian cancer, and that it's not only ovarian cancer, it's most cancers that we're seeing. We're seeing young people, we're seeing them obese, we're seeing them not taking care of their diet, their exercise. The stress levels are huge in this country. Our population is younger. So people need to get a hold of that aspect of their lives. The other thing that you can do, and there is data to show that oral contraceptives are actually protective for ovarian cancer. There have been several beautiful, very robust studies to show that. And one of the theories of ovarian cancer is that a woman who keeps menstruating puts her lining around the ovary at risk, and that gets irritated. And if she can interrupt that either with pregnancy or with oral contraceptives, then that has a protective effect. But see, everybody's not going to follow the oral contraceptive rules. So I just suggest lifestyle changes, which right now is something in our control. Young patients do get ovarian cancer, but they get a type of ovarian cancer called usually germ cell tumors. And I'm hoping that's what this lovely girl has. And these are completely curable. And they go on to lead, yeah, they go on to lead a great life after that, near normal. Of course, fertility is compromised, but other than that, the longevity is fine. And yeah, they do pretty well. They are cured.
Right. Shilpa, I want to ask you, you said you had a daughter when you got the diagnosis of cancer. Now, what was your treatment like? What was the cancer you had? And did you ever figure out how you got it? I mean, was there any reason why you got it?
Yeah, I had figured out in both ways, in mentally as well as clinically. Mentally, of course, maybe due to the stress, it could be the one of the reason. But there was no clinically, there was no history as such for a cancer. But of course, as my doctor told me that it can happen. My periods were irregular, and I was on a very regular checkup. Even I was my exercise routine was also very regular. Diet routine, my exercise, everything was on the path. Still, it was shocking for me that after everything done, still I was prone to this cancer. But of course, there is no rigid reason as such why it happened.
So, Shilpa, what stage was your cancer detected in, and how was it treated? Could you tell us about that also?
Yeah, it was, I think, third C test, C level, and it was treated by, of course, Dr. Shona Nag. She has, I am a patient of her, and there were 3 chemos. After that, we had an operation, and after that, again, 3 chemos. But there was one very interesting part in my treatment was the local chemotherapy was given, which was an additional chemotherapy which was prescribed to me. That chemo was called as, I think, Bevacizumab. Am I right, madam? That she has
No,
recommended.
so you had targeted therapy, and I think
Targeted.
you also underwent HIPEC. I'm not
No,
so
I
sure
didn't.
about that.
No, I didn't had
You
a
didn't
HIPEC.
undergo HIPEC.
No, because Sujay Hegde sir said that we will go with the
Sure.
So
And how many years ago was this, Shilpa? How many
it
years
is.
ago you treated?
I was been detected in 2018 August, and
Okay.
I cured in January 25th, 2019. So it was a 6
Okay.
months. I
Yeah.
can even remember the date of my chemo also.
Okay, so Shilpa went through chemotherapy. Dr. Advani, the last year has been very tough for people all over the country or all over the world because of the pandemic. Now, you said that this is a deep-seated cancer, and the statistics say that the percentage of a deep-seated cancer like ovarian cancer being detected early is low. Now, during the last year, when people are afraid to go into hospital or get checked up, do you fear or suspect that this whole situation will become worse?
I think obviously I must say that during this period, we could not really see any patient who came really early. None of our patient came in the early stage.
So, Dr. Advani, what is then the prognosis for people who, what are the different stages of ovarian cancer? Dr. Shona Nag said there are different types of ovarian cancer, and some types are easily curable. But how do you stage ovarian cancer, and what is the survivability of ovarian cancer?
Yeah, you see, basically, ovarian cancer, if it is inside the ovary, we call it a stage 1. And when it affects the capsule, we call it a stage 2. And when it affects the surrounding covering, omentum, maybe peritoneum, we call it a stage 3. And when it affects the liver and other major organs, we call it a stage 4. Majority of our patients come in the stage 3. 3 is a very common stage. Again, 3 is divided into A, B, C. So C, stage 3C is the commonest type of stage in which these patients come to us with a lot of water, distension of abdomen. That's a common presentation with which only 10% come in the stage 1 and 2. That means 90% of the patients come in stage 3 and 4.
That's quite a shame. Urvashi ma'am, you know, the COVID pandemic is not going away in a hurry. We were all feeling a little more complacent because, in India we had it under control, and now we have a new strain, which is the UK strain, and somebody saying there's an African strain, and this pandemic is not going away in a hurry. So how do we tell people that, don't put off your appointments if you suspect cancer? How do we communicate to them that if, imaging has to be done, it has to be done? Could there be virtual consults with doctors? How can, this worry and fear about contracting the virus, somehow be removed from the minds? Yes, people should be careful, but they should not ignore these risks as well. What can be done to effectively communicate to people to step up and seek the right treatment?
Yeah, absolutely. I think you rightly mentioned that adoption of teleconsultations, in fact, has gone up a lot during this period, and in fact, we see a lot of women adopting that route because it's a little easier. You can do it from the comfort of your home. You can share your symptoms in a fairly private environment because a lot of women, we know, they don't actually go to facilities and seek out healthcare. And this is not a problem just with ovarian cancer, but women's health in general. So of course, yes, I mean, telemedicine, it's not a substitute in any shape or form for actual health services, and also its penetration is not yet everywhere. It's there in a lot of the urban centers, but it's very, like in our country, the challenge is it's not equitable. There's a lot of inequity even when it comes to teleconsultation still. So those are of course challenges, but yes, it is an avenue. It is an avenue to at least share any initial symptoms that you might be getting, and sort of get the right advice on what do you go on to next. But it can never be a substitute for actually going and getting checked up. And I think one of the things that we are also pushing for in the Ayushman Bharat program, I already mentioned the primary healthcare part of it, which I think of course we need to focus on, but also the insurance. We're trying to push for some of the outpatient procedures, the screening, some of those things to also get covered, because that is I think another way that we'll be able to encourage people to come forward. Again, this is not just for ovarian cancer, but it will have a positive impact even on ovarian cancers as well as other types of cancers. So we are trying to also provide some of those, and we're trying to expand those packages as well. But I think in general, the awareness needs to go up in a big way, and there's a lot of sensitivity around women's health, and especially now we're talking about the reproductive system. So it becomes even more of a sensitive issue in many parts of the country. You'll still have women very hesitant to talk about it or to come forward. So I think of course that general level of awareness needs to go up too, but we will have to deal with this COVID-19 situation, and no doubt it has disrupted many services, and of course cancer screening, unfortunately cancer services have also got disrupted in a big way. So I think we will have to really focus on this going forward, and of course maintaining that fine balance is really what is so difficult in a country of our scale and size and diversity. But we do need to focus on that so that we don't end up losing so many additional lives due to other issues, because that's really, I think, one big fear that's already been happening to some extent, and it's a big fear going forward as well for us.
Right. Dr. Nag, if I have a problem, I'm going to reach out to my doctor. If I feel that a follow-up is possible, like if I have to get an X-ray, have to get an X-ray done, I will get it done. So, these are very tough times. How can you give comfort to the patients that, this will be done? Your safety will be, maintained if you're going for imaging, etc. Are sonologists taking all the precautions? Is imaging safe? Should we also drill this into the minds of people that you should not worry about these things?
So I think, at least the larger hospitals, especially in the major cities in our state, have taken a lot of effort to keep the COVID patients separate. In fact, every time a COVID patient is wheeled into imaging, they have a different way of coming in. They have a different section. Sanitization is done after every patient who is on the CT scan couch. And protocols are really in place in the hospital. I must say that's something that all of us are now very geared up to. And we are sanitizing, we are washing hands, we are wearing our masks, our PPEs if required, visors, we have a partition, we are distancing from the patient if required. So protocols are pretty much in place. So I don't think patients need to worry too much, because, like, everybody is saying this, and I'm going to repeat it, that the COVID mortality rate is 2%, but the cancer mortality rate is 50 and 60%. I think you need to put it in perspective. If you've got a problem, don't sit on it. And like Dr. Advani said, we are seeing so many women with huge lumps in the breast simply because they've been too scared and they've waited for 6-8 months. So they've jumped from a stage 1 to a stage 3. And this has happened in a lot of malignancies. I understand the fear, but then go to a place where there are proper protocols, and you will find these places, because people are pretty vigilant nowadays. At least the medical staff are.
Right. Dr. Advani, what is the treatment protocol followed? Shilpa said she went through chemotherapy and targeted therapy as well. So, are the improvements in treatment which is increasing the rate of survival? How are ovarian cancer patients treated? Because, with cancer, women get worried about hair loss, etc. Some women with breast cancer are worried about disfigurement. And, so we want to understand, how is ovarian cancer treated?
He's mute.
Dr. Advani would request you to please unmute yourself. Yes.
Majority of our patients ultimately receive the chemo.
Mm-hmm.
Who are in a stage, always some people we may go without chemotherapy. So the most important thing is the surgery. So we like normally to do the surgery as early as possible. In stage 1 and 2, it's very easy. In stage 3 and 4, one has to be very, very careful. And in those situations, first we give the chemotherapy, reduce the tumor mass, and then do the surgery, and again continue the chemotherapy. Sometimes it's very difficult for the patient to accept directly the chemotherapy, but they do accept ultimately.
Right.
Very rare that they are reluctant. Initially, they may be reluctant, but they agree ultimately. The important thing to realize is that people still have old notions about chemotherapy. In olden days, people used to vomit, they used to have a lot of problems. Today, it is not there. There's hardly any nausea and vomiting. People go home and eat also well. And usually this is given in the daycare. They come in the morning, evening they go back. So obviously the administration of chemotherapy has become simple and with very less and less and less side effects, except the hair loss which goes on occurring in this situation. Treatment is very well standardized also. You go to one doctor, you go to a second doctor, the treatment is exactly the same. You go to India, you go abroad, treatment is absolutely same. So it's so well standardized that people don't have to really worry about it and has to just move on with the treatment. And usually after 3 courses of chemotherapy, we do the surgery again and again give the 3 courses of chemotherapy. Shilpa also, I think, mentioned about intraperitoneal chemotherapy. That is also sometimes we do use it, particularly in a patient who has got a huge ascites, which is not really disappearing fast, we use that intraperitoneal chemotherapy also. The important message is that people have old notions. Those notions have to come out. They always come and tell me, oh, we have heard that the whole body will be burning, there will be body pain, and I will be vomiting, I'll not be eating. So all these are old notions. What happens is that the people who have a very advanced disease, incurable disease, are those who are not going to respond. They have these effects because of the disease. And people think that they are because of the drug, which is not really because of the drug, because of the disease, which is not responding. So I think, therefore, this message must reach the public that chemotherapy is not really something which is dangerous. It's quite easily acceptable. And I'm sure Shilpa can tell us much more about chemotherapy and how she went through it. But I feel that, I talk to the patient quite more often, and they always tell me that they expected something worse, but then it was quite easy to take all the 6 courses and they complete. Nobody remains or sort of gives up in between. Nobody. I think so. That's a thing that patients are, of course, explained everything, but they are able to take it. And we make it very simple also. Like, we don't want the ladies to get punctured in the vein very often. Sometimes we put the port here. So it becomes very easy for them. So all these things are taken care. We are very conscious of what we call it pre-medication and support care, which is necessary. I think the important thing in this condition is also the support. They get it from the family and from paramedics, from the nursing staff. They really appreciate, all these patients appreciate that. They may not appreciate doctors because they meet hardly the doctors, but they meet the paramedical, the nursing staff, their relatives. They are so grateful to them. I think important thing is to make sure that you sit down and explain with the patient, and they are very gracious enough to go through the whole chemotherapy very easily.
Right. So, Shilpa, I'll come to you on this because in many years ago, chemotherapy used to be tough, but since then, even medicine has improved, innovation has come, side effects are lower. How was your treatment like, and what did you think during the treatment? Did you always believe that you will overcome this problem? Did you ever feel disheartened or crestfallen, or did you have a lot of side effects that make you think about giving up?
No, never actually. I was never sad. I was shocked actually more. But yes, the one thing which I really repent was my hairs. Yeah, and they were quite long and thick, and Dr. Nag told me that you better remove it because it will be more painful if you'll see them losing with every
Falling
chemo.
off.
Yeah, falling off. So again, that was the biggest, more than a chemo. It has pained me more actually.
But you have your hair back and they look as good as perhaps.
Yes. Now, actually, I was going to share these things also, that cancer is not that bad as it has been portrayed. There are too many good things, good outcomes after the cancer treatment. Normally in diabetes or other diseases, the people hurt their bodies day in, day out with the tablets and all. This is a short-term disease, and you can very well come out with the good proper medication and support and diet and positivity. With all these things, you can come out. And again, there is one more, the benefit of a cancer. All the cells are rejuvenate. Even you look much younger than what you were. And first you were beautiful and bold, and after the treatment, it is like bald, beautiful and bold. So there are so many positive things also into the cancer. So the perspective of the cancer should be changed actually. It is just a treatment. Take a treatment with proper diet, proper medicine, or proper follow-up. Listen to your doctor, follow their do's and don'ts, and just go through it. Of course, the chemo is after chemo, 2-3 days are painful in terms of you can't eat and all those things. But there are supportive medicines given by the doctors for nausea, for vomiting, for fever, for everything. There are support systems. So you have to just treat yourself like a queen. That yes, I am. मुझे आज ये हो रहा है. Doctor will give you medicines for it. So you
Right.
doesn't have, yeah, there is actually.
So Shifa, that is the reason why we have you, so that you can, bust the myths, having gone through this, and we want to tell everyone that even though, it is detected usually late, you can beat it. And we have living examples
Yes,
with
of
us
course,
talking
yes.
about it and saying that, yes, we can beat ovarian cancer. शिवानी, मैं आपके पास आना चाहती हूँ. आपने हमें बताया कि आप बहुत छोटी थी जब आपका पता लगा कि आपको कैंसर था, आपकी लेफ्ट ओवरी निकाल दी गई. उस समय आपको कैसा लगता था? अब आप मतलब 10 साल बीत गए हैं, आपको लगता है कि कुछ खो गया है, कुछ मिसिंग है आप में, कि ऐसा लगता है कि ये ऐसी एक बीमारी है जिसको हम हरा सकते हैं, और इस बीमारी की वजह से ऐसा नहीं है कि हमसे कुछ छूट जाएगा, कुछ हम हासिल नहीं कर पाएंगे. आपको क्या लगता है?
जब मुझे कैंसर था, यानी कि जब मैं हॉस्पिटल में जाती थी, तो वहां पे जब मेरे को कीमोथेरेपी लगना स्टार्ट हुई, तो जैसे कि सर ने बताया कि बहुत वॉमिटिंग वगैरह होती थी, कुछ खा नहीं सकते थे, कुछ पीने नहीं होता था. तो मेरी फैमिली मुझे तब भी जबरदस्ती बोलती थी नहीं खाओ ही खाओ. तो फिर भी मैं खाती थी, फिर भी वॉमिट हो जाता था मुझे. तो वहां पे एक स्टाफ नर्स थे मैम, वो मेरे को बहुत अच्छे से ट्रीट करते थे, बहुत अच्छे से समझाते थे. तो मेरे को वो बहुत अच्छा लगता था उनका समझाना. और एक सर थे वहां पे, वो भी बहुत अच्छे से ट्रीट करते थे मेरे को. तो जब मेरे फर्स्ट टाइम मेरे बाल रिमूव हो गए थे, तो मैंने अपने आप को स्टोर रूम में बंद कर दिया कि मेरे जब तक बाल नहीं आएंगे तब तक मैं बाहर नहीं आऊंगी करके. तो क्योंकि मेरे भी पहले, जैसे दीदी ने बताया कि उनके बाल बहुत लंबे थे, तो मेरे भी पहले बहुत लंबे थे. उसके बाद कभी मेरे बालों का ग्रोथ नहीं हुआ इतना ज्यादा. तो उसके बाद जब मेरे को पहले तो पता ही नहीं था कि ओवरी क्या होती है, जैसे कि मैंने बताया. जब पता लगा कि मेरा ओवरी रिमूव किया गया है, तो फिर भी उसके बाद मुझे ये भी नहीं पता था कि हम लोगों की 2 ओवरीज होती हैं. तो बाद में मुझे ये चीज पता लगी कि 2 ओवरीज रिमूव होती है. और जब मैं डॉक्टर्स के पास जाती थी, तो यानी कि मेरे को पीरियड्स वगैरह थोड़े लेट आए थे, तो डॉक्टर्स बोलते थे कि नहीं, डॉक्टर्स पूछते रहते थे कि आए कि नहीं आए. जब मैं डॉक्टर्स के पास जाती थी, तो मुझे ये भी नहीं पता था कि तब पीरियड्स वगैरह क्या होते थे. जब वहां पे जाके पता लगा, तो डॉक्टर्स ने बोला कि अब फाइनली ठीक है, एक ओवरी है, तो जो आगे जाके वर्क करेगी.
ठीक है. तो आपसे ये हम समझना चाहते हैं कि ये जो पूरी ट्रीटमेंट थी आपकी, आपने कहा कि डिस्कम्फर्ट था, पर अब इतने साल बीत चुके हैं, आप कैंसर फ्री हैं, तो आप पीछे देखते हुए आप इस पूरे अपनी सिचुएशन को कैसे देखते हैं कि ये एक मतलब बुरा सपना था जो अब खत्म हो गया, और आगे आप जिंदगी को देखना चाहते हैं. आपको लगता है कि मेरी जिंदगी में कोई कमी नहीं है क्योंकि एक ओवरी कम है. कैसे देखते हैं अपने पूरे एक्सपीरियंस को?
मुझे इतना बुरा भी नहीं फील होता मुझे, यानी कि मैं यही समझती हूँ कि एक सपना था, एक लाइफ का पार्ट था, वो खत्म हो गया. मुझे अपने आगे की लाइफ के बारे में सोचना है, मुझे आगे क्या करना है. जैसे मेरा सपना है कि मैं ओलंपिक्स में जाऊं, ओलंपिक्स में गोल्ड मेडल लाऊं. क्योंकि जब मैं बीमार थी, तो तब मेरी मम्मी पापा ने मेरे को, यानी कि मेरे को सब लोग बोलते हैं तेरा दूसरा जन्म है. तो इसलिए मैं चाहती हूँ कि अगर ये मेरा दूसरा जन्म है, तो मैं कुछ ऐसा करूँ जिससे कि पूरे इंडिया को मेरे पे प्राउड हो, और मेरे माँ बाप को खास करके मेरे पे प्राउड हो.
बिल्कुल शिवानी, हम सब बहुत प्राउड हैं आपको देखकर कि इतनी कम उम्र में आपने कैंसर को झेला, बीट किया, और अब आप अपनी आगे की जिंदगी को इतना पॉजिटिवली देख रही हैं. सपने हैं आपके, और हमें पूरी उम्मीद है कि आप अपने सपनों को पूरा करेंगे और हमारे देश का नाम रोशन करेंगे. थैंक यू सो मच.
जब मैंने
आप यहाँ आई और आपने सबको बताया कि छोटी उम्र में भी इस कैंसर को बीट किया जा सकता है, और सबको सतर्क रहना चाहिए. थैंक यू शिवानी.
थैंक यू मैम.
Dr. Nag, for a young patient to have recovered, even it may have been one of those cases or type of cancer that get easily cured. But the message is that, don't be late. You can beat it. We have Shilpa also with us. 2018, she
Absolutely.
was diagnosed and she's with us and she's so positive. So,
Absolutely.
we have very little time. What would you say for all those watching this show, all the ladies watching the show? How should they be alert? And the thing about family history of having cancer, how do what proactive steps should you take?
So my message to all the women who are watching this show is please don't neglect yourself. Women tend to put everybody else in front of them. They tend to ignore their health symptoms till they get very overbearing. And as Urvashi clearly mentioned that, women's health is really on a back burner in this country. So women need to be aware of their bodies. They need to be aware of any change, be it in the breast, be it in the abdomen, be it in your periods, be it in any functioning part of your body. Seek attention as quickly as possible. If you've got a family history, you know that 10 to 15 years before your parent had the tumor, you've got to start coming in for basic tests or at least go for a physical checkup. Once you're 20 or married, you go for a regular gynae checkup once a year, and just give yourself that little time every day to ensure that you have a decent diet, a decent lifestyle, and exercise. So that's my message to everybody out there.
All right. Urvashi ma'am, one question to you. Now, Dr. Pani said that most people don't drop out of the chemotherapy treatments, and a number of people have told us that now the government is providing at least chemotherapy is free of cost. If you have the card and under the Ayushman Bharat scheme, you will get treatment for chemotherapy free of cost, and at nominal rates if you don't have that card. So do you think we need some messaging about the access to healthcare so that people are a little more proactive, women are more proactive to go ahead and seek treatment if the cost is not a big factor?
Yes, absolutely. And I mean, of course, as I said, that with Ayushman Bharat, we're also continuously trying to expand the gamut of what it covers. There are certain gaps, no doubt, at this point in terms of services which could be covered. And also especially the outpatient part, because for a lot of things, you're not actually admitted really per se. It could just be, an outpatient visit. And so we are trying to push for the scope of the scheme to be expanded. It does cover a lot of procedures at this point, but hopefully in the future we will be able to cover a lot more, so that we have this push for patients and women specifically to come forward. And I think the other part we are focusing on is expanding access to services, because one thing is covering the cost, but the other is we don't want the facilities and the treatment to just remain concentrated in a few larger cities. We have to push it out, into our tier 2, tier 3, centers, and eventually also, of course, our rural areas. So we're also trying to focus on that, because, one without the other will not make the efforts as effective. So yes, there's definitely a focus on both those aspects, and it'll be good if of course we try to create awareness, but for citizens to also be aware and to spread awareness about this, that certain schemes and provisions do exist, so that people who need to avail of those can do so.
Right. Shivani has one question. Shivani, जल्दी से अपना सवाल पूछे, समय वापस कम है. She wants to ask the doctors a question. Shivani, पूछे, क्या सवाल है आपका?
एक्चुअली जब से मैंने रिकवर किया है कैंसर से, उसके बाद मेरा वेट गेन नहीं होता, मेरा वेट 40 kg से ऊपर नहीं जाता. तो क्यों, उसके लिए मुझे क्या करना चाहिए अपना थोड़ा बहुत वेट गेन करने के लिए?
शिवानी, अब आप बोल रही हो कि आपका वेट कम है, आगे चल के आप थैंक यू बोलेंगी, क्योंकि प्रॉब्लम उल्टा रह जाता है जैसे आपका उम्र बढ़ जाएगा. सो एज लॉन्ग एज यू आर हेल्दी, एज लॉन्ग एज यू आर एक्टिव, एज लॉन्ग एज आप सब कर पा रहे हैं जो आप करना चाहते हैं आपके स्पोर्ट्स में वगैरह, प्लीज डोंट बॉदर अबाउट वेट. आप ठीक से खाओ, हाई प्रोटीन डाइट पे फोकस करो, और थैंकफुल रहो कि आपका वेट ऐसा है, क्योंकि आगे चल के वेट बढ़ा तो बहुत प्रॉब्लम होता है. सो एज लॉन्ग एज यू आर एक्टिव, इट्स फाइन.
ओके, थैंक यू मैम.
Dr. Advani?
हाँ यस आई थिंक आप ये भी काम कीजिए, वेट बढ़ाना तो बहुत हमारे हिसाब से तो इजी में इजी है, एकदम इजी है। तो और हम सब पेशेंट को हम बोलते हैं, पेशेंट को उनके रिलेटिव्स बहुत रिस्ट्रिक्शन डाल देते हैं। वो बोलते हैं बाबा शुगर नहीं खाओ, डायरी का ये जो भी आर्टिकल्स है वो नहीं खाओ, ये नहीं खाओ, वो नहीं, वो बेचारे को रूखा सूखा बाजरी का रोटी देते हैं ऐसा, तो आधा खाते हैं। तो आप ये सब लोगों का सुनना बंद कर दे, और मतलब जो भी हाई कैलोरी फूड है, जैसे परोठा खाओ उसमें एक्स्ट्रा बटर घी डालो, आइसक्रीम खाओ, केक खाओ, पेस्ट्री खाओ। हम बोलते हैं ये सब खाएंगे ना आपका वजन तो कैसे भी बढ़ेगा।
Dr. Advani, what would you like to say as a parting words to all the ladies watching the show? At one side, we want everyone to have a healthy lifestyle. But, how can they stay alert? Because nobody wants to, have this sudden rock falling on them. If they're not in that high risk group, what can they do? What is your message for all the ladies watching?
I think the important thing is that have a normal, healthy diet. Maintains a normal health. All of us know, and all of us, you, me, we are controlling our weight. Mind you, for us, it's very easy to put on weight if we start eating the way some people eat. But we are controlling ourselves. We are watching our weight and everything. So we are controlling our weight. We are not overeating. We are not undereating. So I think important thing is to have a healthy diet. I don't think that I don't like my patient to go to the nutrition. I say you determine your own what you require and just maintain the weight in a healthy way, among good amount of protein, carbohydrate, fat, vitamins, all these things should be taken. So healthy diet, good exercise. Exercise is the key. You do walking, which is the best exercise, yoga, and any other exercise, which you can do it at cycling and all at home. Swimming is the best exercise for those who are swimmers. So I think the healthy diet and healthy exercise can keep you really going without any disease. And of course, the early diagnosis. So be conscious about it, aware about it, and if any discomfort with a simple thing, at least rule out.
All right. Shilpa, last word from you as a cancer survivor. What would you like to tell women? Should they be afraid of this cancer at all?
No, they should not be afraid, but they should be cautious. They should be checking up with their physique, because normally the bloating of stomach, and which is very, very particular in this type of cancer, and which is actually a key to, to go for further investigation, or to find it something which is not regular in our body. But again, I will just tell women over there, do your regular checkups every yearly. If you have a history, then maybe a 6 monthly. Have a proper diet, proper exercise routine. Don't ever omit that routine of your exercise due to your household works. Do focus on your diet, keep faith on your doctors, keep regular your medicine intakes, checkups, and be positive always. The positivity is the only key to come out of the cancer.
All right. We'd like to thank all our panelists for joining us today and sharing with us their wisdom, their experience, and their words of advice for all those who are watching. Dr. Advani, Dr. Nag, Urvashi ma'am, Shivani, Shilpa, thank you so much for sparing the time and speaking with us today. We really want to raise awareness about ovarian cancer and bust the myths that at this point of time, only the pandemic is something that you should be worried about. You should be in tune with your own self. And if you feel something is amiss, please don't feel afraid to reach out to your doctor. There are ways by which you can get the help you need, the consultation, without taking unnecessary risks. So please be in tune with your body, and definitely stay in touch with all the updates that we bring to you on the IHW Council page. That is all for the show, but we have the series running where we will create more awareness. We'll take up questions, we'll give you solutions and ideas on how you can save yourself from cancer. So make sure that you like our page, the IHW Council page on Facebook, to keep a track of all that is happening. And thank you so much for tuning in. Keep sending us your questions. We will try to give them to our experts, and they'd be happy to answer them. It's a goodbye from all of us. Stay at home, stay safe. Goodbye, and see you again.
Thank you.
Bye-bye.